Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, founder of Migraine Nation and chronic daily migraine survivor. I am super excited to tell everyone that I am here today with Dr. Melissa Geraghty. Dr. Geraghty is a clinical health psychologist and the CEO of Phoenix Rising. She's pretty well known in the migraine community, and I'm so happy that she's here today. Hello, Dr. Geraghty. How are you?
Hello. Thank you for having me again. Excited to be here.
I am excited that you are here. We have Dr. Geraghty on today because we are going to talk about how we feel when our medications fail us. Now, I have wanted to talk about this for a while. This is a super important topic. It's a topic that's kind of timely. Notice that I said when our medications fail us, we don't fail them. And this vocabulary is important. I want to get it out there right now. This topic isn't discussed enough. We talk a lot about everyone having a migraine kit, everyone having a preventive medicine, everyone having an acute medication, but we don't spend enough time talking about the people who might not have all those things in their life. There's a lot of us who might not have a preventive medicine or an acute medicine that works for them. We maybe had one that failed us or many medications that failed us. So Dr. Geraghty, I'd like to start off this conversation by saying that I had chronic migraine for 26 years, starting at the age of 4, before I ever had a preventive medicine that worked for me at all.
Yeah.
So these people that we're talking to today, I have been in their shoes. And you also have a significant migraine history and some other health issues. Would you like to share any of that with us?
Yeah, absolutely. So I have well over 30 medical diagnoses, all stemming from what seems to be stemming from my rare neural tube defects. So I was born with tethered cord syndrome, and then with tethered cord syndrome, because essentially my spinal cord is defective, a lot of different other conditions pop up with that. So I have 5 different headache and migraine diseases, including I had a CSF leak after my neurosurgery in 2019. So yeah, with me, because I'm such a complex medical patient, I do not have any preventatives. I do not have any abortives. I have tried over 100 medications and devices and procedures, infusions, you name it. I've pretty much tried it for migraine disease in particular, and nothing has helped me.
Right. So I think that this is so important because there's so many people out there who just, either never have had a medicine help them, or they had one that helped and it stopped helping.
Yes.
And there's a lot of feelings associated with that. There's a lot you go through emotionally. And I want to address those people and address those feelings for them. So we have had a lot of new medicines come out in the last couple of years. And people were very excited for them, and we waited for them, and they have helped so many of us. And it's been a great and exciting time for our community. But there's also some people who did not exactly get the relief that they were hoping for. And this can take its toll on someone with chronic migraine, or even someone who's had episodic migraine for a lot of years. Are you seeing this in the patients and the people you see in the community?
I am absolutely seeing this. So typically I see the complex of the complex patients, as well as I am one. And most of my patients have had limited benefit or no benefit to even the newer medications. Myself trying the newer medications, no benefit. And indeed, I got rare side effects. So that's fun from the medications. A couple of the injections, I also had some hair loss, which I'm still dealing with, even though I haven't taken them for a couple of years, just because my hair had fallen out at that time. And, it takes a while to grow back. But yeah, for me personally, and I have these open discussions with my patients as well, is for me, and it's going to sound a bit odd, so stay with me here. I have given up hope that I will find a migraine medication that will help me. However, that is empowering for me. It is not hopeless. It is not coming from a place of, I give up, I won't try anything new. Of course, I will keep, trying when I'm able and willing, new procedures, all of that. But I go into it with a very different mindset now of, I've got this no matter what. And even though I don't have hope for medication, I rely on my mental health training and my skills and my coping skills that it's okay. It doesn't mean I like it, but it comes from a place of, like I said, empowerment, to not have the hope. And I know, again, it sounds very odd to say that, but all my life I have had pain since I was born, and just to keep having all of those appointments where you get your hopes up and then nothing works, or you get more side effects, or the side effects last for months after, even one round of a treatment. It does weigh on a person, and it does, it impacts them a lot. So I say it's person dependent. Some people, hope is really powerful and really encouraging. For me personally, it's now accepting that this is just where I'm at right now. And if I find something, that's great, but otherwise I'm not banking on it.
Right. I love that you say that. That was an interesting, I wasn't sure what you were going to say there, but that was so interesting. And I love that you say that it's person dependent, because I do meet a lot of people that they need that hope. They need to know that a medicine is going to work. And I think I was there too. I didn't think anything was ever going to help me. It blew my mind when something suddenly helped me so much. Blew my mind. In fact, I'm not going to tell you what the medicine was, but I left it in my medicine cabinet for 3 months before I tried it, because I was like, that's never going to work.
Oh, sure. And so many people do that because, it's just like, I've been here before, whatever.
Right. So what do you say? Well, let's move to, people with migraine have relatively high rates of depression and anxiety. So, I mean, even if you aren't depressed or anxious and you have a medication fail you, it's rough. So I worry about the people that are depressed, are having a lot of trouble. They don't have some of these coping skills maybe that you're talking about. Can you speak to them a little bit?
Absolutely. And so what I've seen in my patient population and just in our general community is when people keep getting medications that fail them over and over again, and are also, in addition, medically gaslit, as we talked about in our other podcast, that combination can be deadly in a very real sense. Of suicidal ideation can go up. People, we hear all the sad, tragic stories of people taking their lives due to migraine disease. And when that depression hits so hard and when there's no hope, I tell people, talk to our community, because there's so many people who can relate. And that's comforting. Not that we want people to be able to relate, but just trying to get us through those really difficult times when people have these really dark thoughts. If they can't see like a professional, if they can see a therapist, psychologist, oh my goodness, that would be amazing. But I understand that there can be limited access. So if people don't have loved ones in their lives that they can trust, I've found that the migraine and headache community is so open and embraces people and can be very supportive of getting people through those difficult times.
So there's two things I'm going to ask you. First, in case people didn't see the episode on medical gaslighting, or they're not familiar with the term, can you just say what that is?
Yeah, medical gaslighting can occur with medical professionals or peers or family members, friends, our bosses. And it's essentially when we're made to feel undermined in knowing our bodies, where example is from a medical doctor saying, oh, that shouldn't be such bad pain. That's just a headache, when referring to chronic migraine. So it's just very dismissive, and making us feel like we're the ones with the problem. Maybe it is all in our head and that.
Okay. And then I was going to ask you, how do we know, if we've had migraine for a long time, this is what pain does. I mean, pain does not make you feel great emotionally. It's going to bring you down.
Yes.
So we might not recognize when we're really in trouble, when we're really depressed. How do we know when we need to seek out someone like you, seek out a pain psychologist, seek out a professional to talk to? What are the signs at ourselves that we want to look for?
Absolutely. And sometimes when someone is so in that place, like you said, they might not even recognize it. So it might even start with feedback from others saying, hey, I noticed you haven't come to X, Y, or Z in a while, or you're not as responsive when we're talking or text. So there's that aspect. Other aspects is if a person notices that they're withdrawing more from friends, not communicating, not trying to reach out, friends and family, if they're staying more in their bedroom, even when they're not having an active acute episode, if they're just feeling sluggish, more hungry than usual, less hungry than usual, those are the type of things that starts to make a person think of, maybe something else is going on here.
Right. And I think withdrawing from friends really is normal. I did that in high school completely, mostly because I didn't want to explain anymore. And so it is interesting how, depression can show up because you think you're just like, I just don't want to talk about being in pain. I don't want to bring everybody down. And so here I am by myself for a year all of a sudden, and so I do think we need to watch out for each other. So I remember what it feels like to have these treatments that you're really dependent on stop working or fail you, and it's rough. And so where I start to wonder, and I want to know what your opinion is when people, so you said that you've sort of like given up hope because the hope was harder for you. And this is dependent on people. So, but what I see in people that I talk to is they will completely cut themselves out of the medical community. They will no longer go to doctor's visits, etc. And they pretty much don't ever find out if a new medication comes out. All these sorts of things, and they just don't talk to physicians anymore. And I'm wondering what you have to say to people like that.
Yeah, I'd first like to give an example of something that happened personally to me a long time ago when I was in my early 20s. And I was having new symptoms and they were quite severe. And I thought that, oh, this is just different migraine symptoms. I should go talk to my doctor about it. So I had gone to my pain doctor and he said, yeah, it's time to go to a neurologist. And I hadn't wanted to. I had bad experiences of being medically gaslit before by multiple neurologists. So I hadn't gone in years, but these symptoms were very concerning. And so I agreed with my doctor, I'm going to go. And I showed up to that appointment with the new neurologist, and I had my long list of medical conditions because, again, I'm a complex patient, and I felt ready and articulate. And he looked at me and he laughed and he said, the next time your husband marries, he should marry someone fat and ugly because they'll be too scared to get sick. And he completely dismissed all my symptoms, kind of put them into a constellation of, oh, it's just your fibromyalgia, or, oh, and it's like anxiety, just very horrible experience. And I went back to my pain doctor crying. And I was like, I can't see another neurologist. You're going to have to help me. I can't. And after he consulted with a lot of his peers, and we did more, just tests to rule things out, it was determined I had cluster headaches.
Oh, wow.
And so that neurologist had missed it because he was so keen on me just being an overdramatic woman.
Right.
Yeah. So I personally understand when people stop going in the medical community. I had a conversation the other week with a patient who is just exhausted because she has been going to a lot of different doctor's appointments. And I reminded her that it's within her power to decide when and where and with whom. And so that's something that we can consider, that if we need a break, we should take a break, and that's okay. And you might have loved ones then kind of pressure you, well, why are you taking a break? Don't you want to get better? But the thing is, that is a coping skill within itself, knowing that when we've hit our limit and kind of need to step back and make decisions on when we're feeling ready to try again.
Right. I love that you said that. Thank you so much. Is there anything else you would like to say to our audience, to people out there who perhaps, have been failed by multiple medications and are maybe in a rough patch?
Yeah. As hard as it is, try to show yourself compassion, whatever that looks like to you, whatever that means to you. There's no right way of doing this thing called life, especially with migraine disease. And so again, it's about, I say this so much, honoring our experiences, showing ourselves compassion, and really reaching out to our community, listening to podcasts like this, joining those migraine and headache Facebook groups and other social media groups, going to events, so you feel less alone.
Right. Right. Well, thank you so much, Dr. Geraghty. Thank you, everyone who joined us today. I hope that everyone got something from today, and please join us again next week for Heads Up, the official podcast and webcast of the National Headache Foundation.